Hello and welcome to the Health Pathways how-to video series. This short video aims to provide some tips on how to use the Health Pathways portal. Starting on the front page, firstly search on the condition of interest. Unsurprisingly, at the top of each pathway is the title, then About, which details a short description of the condition. Then, if relevant, red flags, which aim to highlight the most serious clinical risks that are easily missed. The main body of each pathway is divided then into 4 sections: assessment, management, request, and information. In assessment, as you might expect, this section details obtaining a relevant history, risk factors, symptoms, ensuring alternative diagnoses are not missed, appropriate examination, as well as recommended investigations to consider. In the management section, you'll find appropriate management and strategies, which will obviously vary from pathway to pathway, but includes when to consider requesting specialist opinion or assessment. I'd just like to point out, whenever you see a plus sign, that means that there is further information to read, often in a drop-down box. And when you see this arrow, it means there's further information on another website. Once you finish, simply click out of the browser to return to the pathway. The next section is request. The name of this section relates to the fact that you are requesting a service for your patient, and it lists the relevant appropriate referral options, including the ones presented in management. These options then link to service information pages, also known in Health Pathways as request pages. Clicking on one, the first thing you'll notice is that the information is organised into the 9 regions covering the SA Health local health networks, 3 metropolitan and 6 in country. Having a closer look, here you can access the service criteria, exclusions and inclusions, required information from making the referral, and then under Contact the Service, you'll find the referral options, including phone, fax, and if there is any referral form, but also further information that a referrer might need. Remember, Health Pathways South Australia is a dynamic tool and a work in progress. So if you have any service information, please send through feedback to the Health Pathways SA team. Then at the end, there is also information that your patient may need. Going back to the pathway, the last section is information. This is organised into information for health professionals, for patients, and also further reading. Earlier I mentioned about feedback. The Send Feedback button is at the bottom and the top of every single page. So if at any time you'd like to contact the team, this allows the user to provide feedback. For example, you might have service information, you found a broken link, or you'd like to provide suggestions for improvement. Please click to send us feedback at any time. Thank you for listening, and don't miss the next 2 videos in the series where our GP clinical editor, Dr. Katrina Couchman, will run through some useful ways to use Health Pathways when you're in a consultation with a patient.